Which of the following is a key consideration when initiating ECMO in a patient with cardiac arrest? A. The patient must be on mechanical ventilation. B. ECMO should be initiated within 6 hours of arrest to maximize survival chances. C. The patient should be stable on inotropic support before initiating ECMO. D. ECMO should only be used if the patient is expected to recover consciousness within 72 hours. Answer: B. ECMO should be initiated within 6 hours of arrest to maximize survival chances. Explanation: Early initiation of ECMO within 6 hours after cardiac arrest significantly improves survival chances. Timely support is critical in improving outcomes, particularly in cases of cardiac arrest where conventional resuscitation has failed. The sooner ECMO is initiated, the better the chances of recovery for the patient. What is the most important factor in the success of ECMO therapy? A. The patient's age. B. The underlying cause of the failure. C. The duration of ECMO therapy. D. The type of cannulation technique used. Answer: B. The underlying cause of the failure. Explanation: The success of ECMO therapy is largely dependent on the underlying cause of the cardiac or respiratory failure. ECMO is most successful when the underlying condition is reversible, such as in cases of severe ARDS or acute cardiogenic shock. The prognosis will be poor if the underlying condition is irreversible, such as in cases of advanced, unmanageable organ failure. Which of the following is a common complication of long-term ECMO therapy? A. Spontaneous hemostasis. B. End-organ ischemia. C. Involuntary muscle contractions. D. Increased platelet count. Answer: B. End-organ ischemia. Explanation: Long-term ECMO therapy increases the risk of end-organ ischemia due to potential complications like poor perfusion or insufficient oxygen delivery to tissues. This can lead to damage to organs such as the kidneys, liver, and brain. Regular monitoring of organ function is essential in long-term ECMO patients. Which factor is most commonly associated with ECMO-associated bleeding? A. Hypovolemia. B. Thrombocytosis. C. Use of systemic anticoagulation. D. Hyperglycemia. Answer: C. Use of systemic anticoagulation. Explanation: ECMO therapy requires systemic anticoagulation to prevent clotting in the circuit, which increases the risk of bleeding. This bleeding can occur at cannulation sites, within the ECMO circuit, or within organs. The management of anticoagulation levels is critical to minimizing this risk. In which ECMO configuration is both the heart and lungs supported simultaneously? A. Veno-arterial, VA, ECMO. B. Veno-venous, VV, ECMO. C. Arteriovenous, AV, ECMO. D. Venous ECMO. Answer: A. Veno-arterial, VA, ECMO. Explanation: Veno-arterial, VA. ECMO is used when both the heart and lungs need support, such as in cases of cardiogenic shock or cardiac arrest with associated respiratory failure. Blood is drained from a vein and returned into an artery, bypassing both the heart and the lungs, allowing for support of both organs simultaneously. Which of the following is the most common cause of mortality in patients on ECMO? A. Pulmonary embolism. B. Multisystem organ failure. C. Respiratory infection. D. Hemorrhagic complications. Answer: B. Multisystem organ failure. Explanation: Despite the life-saving potential of ECMO, the most common cause of mortality in these patients is multisystem organ failure, often due to prolonged ECMO support or complications related to the underlying disease. Infection and hemorrhagic complications also contribute but are less common than organ failure. What is a key factor to monitor when weaning a patient off ECMO? A. Blood oxygen levels. B. The patient's blood pressure. C. The patient's ability to tolerate minimal mechanical ventilation support. D. Renal function. Answer: C. The patient's ability to tolerate minimal mechanical ventilation support. Explanation: When weaning a patient off ECMO, it's crucial to monitor the patient's ability to tolerate minimal mechanical ventilation support. Gradually reducing ECMO support allows the heart and lungs to recover, and success is contingent upon the patient's response to decreased support, including their ability to oxygenate and ventilate effectively without ECMO. Which of the following is a primary concern when using ECMO in a neonate or pediatric patient? A. Electrolyte imbalance. B. Cannulation technique. C. Mechanical ventilation support. D. Vascular access and cannula size. Answer: D. Vascular access and cannula size. Explanation: in neonates and pediatric patients, finding appropriate vascular access and selecting the right size cannula is a primary concern due to their smaller blood vessels and delicate anatomy. Ensuring proper cannulation and blood flow rates is essential to prevent complications and ensure adequate ECMO support. What is the role of an oxygenator in ECMO? A. To pump blood through the circuit. B. To filter waste products from the blood. C. To provide gas exchange, oxygenation and carbon dioxide removal. D. To regulate blood pressure in the patient. Answer: C. To provide gas exchange, oxygenation and carbon dioxide removal. Explanation: the oxygenator is the component of the ECMO circuit responsible for facilitating gas exchange by oxygenating the blood and removing carbon dioxide. This function mimics the role of the lungs, allowing oxygenated blood to be returned to the body. Which of the following is an essential consideration when choosing between veno-venous, VV, and veno-arterial, VA, ECMO? A. The presence of heart failure. B. The need for systemic blood pressure support. C. The patient's age. D. The need for anticoagulation therapy. Answer: A. The presence of heart failure. Explanation: the choice between veno-venous, VV, ECMO and veno-arterial, VA, ECMO largely depends on whether the patient is experiencing heart failure. VV ECMO is used for respiratory failure alone, while VA ECMO is needed when both heart and lung support are required, such as in cases of cardiogenic shock.